constituents, student, faculty, alumni, donors, trustees, everybody. Welcome to our UPSEM community webinar, broadcasting live with a variety of our chaplain alumni who are serving in a variety of settings, especially in the wake of COVID-19. We wanted to hear from our constituents, hear a little bit about how the pandemic has affected their ministry and what it is like to be in ministry right now in the wake of COVID-19. I'm going to allow our panelists to introduce themselves, and I'll ask Lynn McClintock to start us off.
Sure. Thank you, Crystal. And hello, everybody. I'm Lynn McClintock. I'm a 1987 D.Min alum of Union a long time ago. And I currently work as Director of Pastoral Care in a long-term care facility for seniors. We have about 850 residents on our campus and about 650 staff. We have a staff of chaplains, but that's where I am currently.
Thank you. Laura?
Hey everybody, my name is Laura Kelly. I am a chaplain for a hospice organization in Ohio, and I'm glad to be here. So thank you for having me.
What year did you graduate, Laura?
2016.
What'd you get?
An M.Div.
Okay, thank you, Laura. Harry, tell us a little bit about yourself.
Okay, I'm Harry Simmons. I am a 1984 graduate of the Presbyterian School of Christian Education. I currently work as a staff chaplain in one of 5 polytrauma centers throughout the country. We have 5 veteran polytrauma centers throughout the country, and I work at one of those. And I've been working there for about 28 years. I work specifically on mental health and substance use areas.
Thank you, Harry.
Mm-hmm.
Matt, tell us a little bit about yourself.
I'm Matt Sauer. I graduated in '96 with an M.Div and the Master of Arts in Christian Education. I am currently serving as a co-pastor in a Presbyterian and UCC cooperative ministry. But I also work at a local hospital where I'm an on-call chaplain and then a casual chaplain is the great HR term. But also I head up the chaplaincy for law enforcement in our local community as well. So have a lot of different hats in the way chaplaincy works.
Wow. Well, just in this short period of time, we can see a width and breadth of experience here in the chaplaincy field. So I just want to thank you all again for joining us. My first question is just sort of, what has your life been like the past few days in the wake of COVID-19, either for you personally, serving in your fields, for the people that you serve? Just tell us give us a window into what the past few days have been like. Laura, why don't you start us off?
Okay. Yeah, the past few days, or how life has been for me, was a rapid change to doing chaplaincy from a distance. So supporting people based on their preferences and based on the need to protect the safety for everyone. Just learning how to find connection and meaning for people over the phone or over video face-to-face conversations. And, now I think we're at a point where it's time, for me to start thinking, what is the process going to be to integrate back into face-to-face visits while still respecting, autonomy and making sure that patients feel like they can choose, or families feel they can choose what would be safest and most effective for them to feel supported. So it's a constant change, constant learning, but I think chaplains are wonderful improvisers in ministry, so we just go with it.
Right, Laura, I like the piece that you lifted up about sort of thinking about what your what the people you serve would need and what would feel good in terms of their boundaries or their limits. So thank you for sharing that. Harry, why don't you tell us a little bit about the past few days for you?
Well, only yesterday, we had chaplain service had an infection control doc to come and present, I would say, like a didactic information concerning COVID-19, and actually what happened was he allayed a lot of anxiety that some of the chaplains had, because we were told we only have one patient, one COVID patient within the facility. That's important because what we have to schedule. We have nine chaplains, 9 full-time staff chaplains, and so we have a schedule. We provide 24/7 coverage for the medical center, and we have a couple of designated areas for our COVID-19 patients, and so we decided that we're going to have there are 2 chaplains who volunteered to be dedicated to covering our COVID units. And then the other chaplains are dedicated to covering the non-COVID units. And this is important because some of the staff would prefer that we not, if we're serving on a COVID unit, that we only serve on the COVID unit.
Not crossing, right?
And not, yeah.
Yeah.
And so that was very, very important. So that was a highlight of what happened yesterday.
Right. When it sounds like also some discussion about how to allocate resources and make the most of your team, and
Exactly.
just some of those kinds of conversations.
Yes.
Matt, what have the past couple of days been like for you?
Well, every day going in the hospital, it gets different with the, we have daily, sometimes twice daily memos about what we're wearing, and
Right.
how we're going to prepare, not simply for someone who might be COVID positive, but of course now there's, for every patient in the hospital, there's new protocols, and whether mask and face shields, do you change in the scrubs, do you not, and that's a daily changing thing that we have to work with. Honestly, a lot of what I've been doing the past few days, actually the past few weeks, is just a lot of staff time, just listening to the staff.
Exactly.
I mean,
Yes.
the patients,
Yes.
unfortunately, are a little hands off right now, unless there is an immediate crisis, and learning how to be a ministry of presence when you're not present is interesting, but it's listening to the staff and their anxieties and the things we're reading about in states about the opposition to staying at home and how that's affecting them and how people are treating them if they walk out in scrubs or something in public places. Sometimes it's not always met with positive responses. And so just listening and caring for them that way. Been a lot.
Right. So, and also part of what I hear in that, Matt, is you're spending a lot of time giving pastoral care to staff members as well, not
Yes.
just patients.
Yes, that's
you're
switched
shepherding the
significantly.
Yeah. Right.
Yeah, that's very true in my facility as well. A lot of the ministry is with the staff right now.
Lynn, thank you, Harry. Lynn, could you talk to us a little bit about your past couple of days, what that's been like for you?
Sure. Past couple of days have been better than the first couple of days.
Okay, fair enough.
I think at first, everything was just sort of a full stop because we didn't know, we had our residents stay in their rooms, and, we have had 2 positive COVID cases among residents and 4 among staff. And so the adjustment for our community has been huge. We have independent living, assisted living, memory care, and health care. So to kind of come to a screeching halt with dining rooms instantly being closed, and within 4 hours shifting from a seated dining service to meals in their rooms delivered. It's been a huge challenge for our staff, and they've really done an amazing job. At first, our visits were limited. Now chaplains are able to go to healthcare and assisted living floors, and we're doing a lot of phone calling. Each of our residents are called every week, either by chaplains or social workers. We're trying to maintain that contact. It really does sort of distill and clarify what are the essentials for a community. And it's ritual, it's worship, it's pastoral care, it's contact, and we had to really rethink all of those things. Luckily, we have an in-house television station, and so we were able to give communication every day, first twice a day, to our residents. What's the latest information in our city, in our state, what the latest rulings of our governor are, and what the policies now of our facility are as well.
Lynn, I'm sorry to cut you off. You were just helping me start to think about how people have had to sort of pivot or transition. The normal methods of pastoral care aren't really available in the same way because of COVID-19. And you were starting to talk about some things you all are doing. I'm wondering if some of our other panelists have been doing other kinds of pivoting like this, or creative ways of being in touch or being present when you can't physically be present. Laura, have you been, what kinds of things have you been doing?
Well, I think that in a lot of ways, people know part of what COVID is bringing into our attention is that people can find within themselves and within their own grief journeys and processing that there are ways that they can meet themselves and look at themselves. So helping them to build their own rituals, helping them to, I know I can't physically hold your hand, but can we both put our hands on our hearts? Can we both, rest our minds as if we're together? Because I think at the end of the day, what people want to know is that we are connected. So, leaning into knowing that I cannot be with you. If I could, I would, but what can I do now? I can listen and I can affirm with you what you're going through, and we can mark your feelings in this moment. And I think that that's been done before. I think in different ways when we've connected across time and space with our loved ones. It's just now it's all coming to the forefront.
So maybe a skill we've had, but it's maybe a lesser skill, or one that sort of hangs out in the background, but now we're having to kind of bring that forward and really exercise it, really flex it.
Right, and I agree with what Lynn was saying, that ritual really will be what helps ground us and get us through, even if it means when you wake up in the morning, you just breathe deeply for 3 minutes. I think we're being reconnected to the importance of marking our days with rituals and how that will carry us through our difficult emotions.
Right. Well, and you're both helping me think about our long Christian tradition, our long heritage of any myriad of ancient practice or ritual. Matt, what do you think? Have you been doing anything kind of creative to be present, but while not being present?
Well, we've been trying to work on the technology with social media, and being able to connect a patient with a family. The problem is that even when we can get the technology on our end, doesn't always mean the family has it on their end.
Right.
And what does that mean? And sometimes the family is in quarantine in their home and the patient in the hospital, and we can't even run things to them, but just, trying to struggle. And then what happens when a patient can't hold a phone or an iPad or something?
About that.
Do you potentially expose someone just to come in there and just hold that electronic device up for them? but, struggling with, we've also just been reaching out to family in ways that we wouldn't normally. Normally the family, is that we see them when they're at the hospital with their loved one. But now we've been doing more calling of the family just to say, hey, maybe you got the technical update from the medical staff, but how are you doing? Is there a message we can pass on in some way? Sharing those types of things. But it is hard because it's different. Again, so much of what we were taught was that ministry of presence and it's just being there and holding their hand, even if you don't say any, all those types of things.
Right.
And so learning new ways to say we are connected, even if we're not physically connected.
Right. Having to rely on some of these other, I don't know, skills, activities, rituals.
Right.
Yeah.
Which, if I could jump in there, I mean, think about grief. I mean, when someone dies, families can't be together. It's really, really tough.
Yes.
Yeah, not only not at the moment of death, but then also,
funeral.
under 10 people at a graveside service. Well,
Yeah.
Exactly.
And that will be long-term generational impact for families and communities. We don't even know yet. I think that's one of the things, that I think we're all dealing with is just the unknown. Just not really sure how it's all going to shake out in the end.
Right. And you were helping me, Lynn, think about trauma in the long term, just the ripple effect of trauma. So, and that's what happens to us immediately in our families, but then sort of how that radiates out into our communities, our states, and so on and so forth. Harry, what have you guys been doing over there that maybe is a little more just different, finding ways to be present without being present or relying on our traditional mechanisms?
Well, I want to echo what each of our panelists have said, pointing to technology and the increased use of technology, even for doing rituals, doing rituals with the technology.
Right.
And like visitation, like for example, on the COVID unit, we have iPads that the patient used to talk to the chaplain who's outside of the room. And medical staff would say, if you don't have to go in the room, don't. So we have an iPad we can actually talk to. They can see us, and we can talk using the iPad, and that's different. But with in our care for staff, we are also using technology. And rather than meeting in a room where we have sometimes 20 staff members meeting for huddle, like in on the units, mental health, substance use, whatever, and you can't do that. So now we have to meet. We use some other collaborative apps to help us to meet together, and that way we support one another. And what it all says is that the human touch and being social is so important, the personal touch. But when you can't have that personal touch, the technology does make it possible to see each other and be with each other.
Yeah, maybe a next best thing.
Yeah, next best thing. No doubt about it.
Yeah. Well, we have just a little bit of time. I want to see if we have any questions from anybody who might be joining us today via Zoom. Anybody out there with a question? Just pause for a moment.
Looks like there are 2 questions in the question and answer.
Oh, why, here they are. Why, Laura, thank you so much. Okay, so here we are.
Technology thing.
Yes. So Marie Kelly, one of our alumna, has asked the question, what has been your experience with support of funeral directors as they have re-engineered the celebration of Christian burial in life? We were talking a little bit about this before we started. Lynn, do you want to talk a little bit about this?
Yeah, we have a great relationship with our local funeral directors and their staff, and they have been just absolutely wonderful. And that is a point I want to make in terms of mutual support. I mean, when we are able to support each other and see each other with a common mission, it's super helpful. I did a graveside recently where a son of a resident died, and they were not able to be present.
Oh,
And one of our wonderful funeral home staff literally held my cell phone and videoed the service. And then we were able to download that to YouTube. And sadly, both parents were not living in the same part of campus either. So I can tell you it's probably one of the hardest days in my ministry to take my laptop into two different parents' room and have to show them their son's memorial service.
I can't. I
And
just can't.
yeah, and so if I know how hard that is for me, I'm sure our funeral directors and their staff are seeing some very difficult situations. So my heart goes out to them. But in our case, they've been absolutely wonderful.
We have a question from Clay McCauley, our current director of alumni, also an alum. He says, how are each of you as caregivers? What are you doing to take care of yourself and your families during this pandemic? And I think that's important that we sort of share with each other, we resource each other on what we are doing to take care of ourselves in times of crisis.
I appreciate that question and think that there's our, like everybody else, we have our own stressors. So I have a wife that's working from home. I have a college student that's home from college having to do classes. I have a middle school student at home trying to do classes. I'm going to do things. Our house isn't that big. It never seemed that small, but now it seems very small. In my neck of the woods, the weather has not been very nice. We have going outside has not been that easy. Today it's great. It's in the 50s and sunny today. So it's been hard. And so I'm not saying this to be glib, but it's been kind of nice at times for me to go out to the hospital. And I think nice for my family to sometimes have me out of the house. It's one less person in there, but we're trying to take walks. We're doing, game nights with friends via Zoom. And I find myself reading more, which things that I wouldn't normally give myself permission to read, because, just more fiction and just fun stuff.
Just more time. Yeah, we're all getting reacquainted with our families and our friends in some ways, spending a little more time together, but that creates other kinds of stressors sometimes. So,
well, I'd like to say one thing, if I may, Crystal, and that is, one of the benefits, my wife, my family, I can come home and now we have a meal together.
Yes.
And I grew up like that as a kid, but along the way, people just came and went, come and go and eat, in different places, family. But now we're eating together, gives us time to talk and to share.
Yes.
We'll take walks together and we do a lot of things together.
A little bit of returning to basics.
Exactly.
The things we always say we would like to do if only we had time.
Exactly.
Yes.
Yeah, I do try to stick to some morning meditation. Our chaplain team is doing meditations every morning to center ourselves. And then some of my good friends from college, we have a dance party on Zoom every single day at 12:05. And so that's just been wonderful. And just turning off Twitter after a certain amount of Twitter, you just can't take very much more.
Right. Yeah. Thank you, Laura. Lynn, do you have anything you want to add? We're just about out of time in terms of self-care.
Same thing. I mean, we all look at what we love and we try to do some of that. For me, it's gardening and walking, and I just try to do that, try to get enough sleep and eat right, connect with my kids and their spouses, and just trying to keep it simple.
Right. Exactly.
I know it looks like Molly Smirko asked about CPE. I wonder if Harry could answer that.
I was just getting to it, Laura. But I did want to say to Harry, I wanted to give Harry a chance to answer the CPE question.
Okay.
Harry, can you envision CPE in this time? What does it look like in the wake of COVID-19?
Well, in nationally, what's going on is a lot of CPE students who are residents are doing their educational hours from home, but using the technology, and they can't do the clinical work like they were doing it. So a lot of CPE programs have had to modify how their educational curriculum and how the students are going to be able to meet those hours, because there's liability involved.
Mm.
And so there's, each program is kind of doing its own thing, but students have the same, CPE residents have the same kind of concerns that staff chaplains do, and about safety and also
Right.
being responsible and getting the work done they are there to do.
Right. So it sounds like that's still an evolving
Yes,
process, which I'm
it
sure
is.
a lot of ministry will continue to be in the wake of COVID-19.
Yes.
I just want to thank our panelists so much for joining us today. I think this has been a rich and helpful conversation. I hope our viewers online have found it to be the same way. We are recording it, and so it'll be posted in a variety of locations, Facebook, YouTube, so on. Panelists, do you have any parting words, any sort of thing you would really want us to know about chaplaincy in this time before we sign off together?
I think one thought I've had lately is, we may not always be the first responders as chaplains, but we're often the last responders.
Oh,
And I think that, we're trained to be with people wherever they are. And, this is really forcing us to be with society where it is as well, to
right.
recognize the impact that it has on us personally, and to work through that, and to just be present. And that can be some really dark, lonely, hard places.
Absolutely.
But I think as we look more and more to where joy is, that's what's going to get us through.
Thank you. Thank you for
And
that.
I would say that this is the time to really step up and do the work of the Lord, because people are afraid. People have a lot of anxiety, and they especially are looking to clergy, chaplains for guidance and support and compassionate care. And if there's a time to do it, it's now.
Thank you for saying
Right.
that, Harry. I think it probably is across for all ministerial fields. Now is the time
Yes.
for us to up
Yeah.
our game and figure out how to be creative and ingenuitive.
Yes.
Matt, do you have anything you want to share with us before we go?
Sure. I just playing off of that last statement, I'd also just say we need to give ourselves permission to not be everything all the time to everybody. And that goes back to that
True.
self-care thing.
Yeah. Yeah.
And each of our contexts is unique. We all have our own skills. I'm also convinced that all of us are operating out of the love and grace and compassion model. And therefore, we're going to do our best, but just be patient with pastors and chaplains. We're figuring this out too, and we're scared too at times.
That's very good. That's very good.
So let's have grace abound, and do perhaps what is innate in us as our calling beyond any other skill set. It's just the call to love. And let's find ways to do that.
Very good. Very
Matt,
good.
Lynn, Laura, Harry, thank you so much for joining us today. What a wonderful conversation we've had. And to all of our friends out there in the community, thank you so much for joining us.
Hey, Crystal.
Yes.
I'm sorry to interrupt. This is your producer. Let's go 5 more minutes so that we can answer 1 or 2 more questions. We have a couple more.
By all means, I'm delighted. Panelists, can you stay with us for just a few more minutes?
Sure.
Sure.
Yes.
Let's see. So Jane Mitchell has a question. Have you identified anything that you believe will be positive outcomes or developments from this situation? I think that's a great question, panelists. Maybe one or two of you can answer this one. Lynn, I see you nodding your head.
Well, I mean, you know, that's kind of where I put my heart these days. We are building a brand new, really large sanctuary, and we don't know yet when we're going to all be able to be together in the way that we had imagined.
Right.
But I just think about that glorious day, who knows how long, where we will all be together. And I think that sense of community is going to be outstanding and amazing once we are able to be together in a safe way. So I think our new sense of community is going to be really amazing.
I think one of the positive things that's come from this is conversations about telehealth and telechaplaincy
Yes.
have been kind of bubbling under the surface before COVID-19. And COVID-19 really, it got us on like Super Mario mode, and we, had to figure it out on the go. But it was something that was already in conversation. If we're going to reach higher amounts of people and try to meet them in different ways, that the idea of telechaplaincy face-to-face through video, and using our training, our clinical training to assess people spiritually without having to be with them. That was already a conversation that was being
Yes, that's true.
Yes, so this just kind of accelerated that conversation. And I think in a great way, we'll be able to continue to do this when we can't get to people quickly enough. And I think that it's good to have this conversation meant to meet fruition in a way.
Right. It's just sort of stepped on the gas. It's just sort of made us had to force some questions or some issues.
Exactly.
And some skill development. Harry, I hear you kind of echoing that. Do you have something?
Yeah, because there's a proliferation of the use of technology, and it's not going to stop.
Right.
And everyone's going to need to. Well, there are people who, and look at all the folk who have lost their jobs. 30 million folk, okay, they're out there too, and they need love and care, and they need not be forgotten.
Right.
And so I think we're in a new day. I don't think it's going to return back to what it was. I think there's a new norm that's going to be established, and it's going to be different. And it's going to. The Marine said we have to learn to adapt to the changing environment, and the environment has changed, and we must adapt.
Yes, I would agree. And I see other panelists nodding their heads. Matt, do you have any ideas about that? Any positive outcomes that have come from COVID-19?
Well, the bridge building between family and patients when family can't be there. Again, it's not like this is new technology, but we haven't always employed it. I think of, my parents are 5 states away. To know that I can connect to them in a hospital room if I need to, I think is going to be growing. We've got mobile families now, and I think for us as chaplains and pastors to be these bridge builders, and some of that might be the work of reconciliation, but it's no longer tied to who's able to get to the hospital room. Now we can help facilitate those conversations, those healing and therapeutic conversations across thousands of miles and perhaps even on the other side of the world. So I'm positive about that.
The importance of being able to see.
Yes.
It's incredible. We for a long time, Gen Xers, we know about hearing, but that ability now to be able to see is something that's I think has a great impact, and it's something that you're talking about bringing into your ministries in the wake of COVID-19.
And can I say one more thing that I've noticed has come from this is the incredible collegiality of pastors, ministers of all different faiths, just coming together, sharing resources in ways that are so beautiful. This panel bringing us together. I mean, this is sacred and holy that in times of crisis, we come together and we share. We don't hoard our resources. We strive to share it with one another to give the best care. And that's been really beautiful in this particular field.
Yeah, and Lynn had lifted up that earlier too about sort of the different kinds of care partners in the care field working together and just trying to collaborate and get creative, and so that we can bring our people the best service and God's love and grace and compassion in a time of crisis.
Yes.
Well, I'm going to check in with my producer, Michael. Are we at time?
Unfortunately, we are out of time.
Okay, all right. Well, I just want to say thank you again to everybody who joined us online for
Thank
all of
you.
these great questions
Thank you.
and helping us guide our conversation. Thanks to our panelists, Laura, Lynn, Harry, Matt. Thank you so much for joining us. UPSM community, stay tuned. We'll be doing another webinar on another topic, and we hope to see you all again soon. Okay, God's blessing to everybody.
Thank you so much.
Amen.
All
Everybody,
right.
Peace.
Take care.
Okay.
be well.
Likewise.
Okay.